Good day and welcome to a new IEMO animation. This time we discuss why medicine is different when it comes to older patients. Increasingly, doctors are expected to act according to the principles of evidence-based medicine, in other words, EBM. There are three elements that define EBM: the patient's preference and situation, scientific evidence, and the knowledge and experience of the doctor. Aging causes these elements to change for the older patient. Let's have a look at these one by one. As a group, older patients are more heterogeneous than younger patients. Much more than in younger patients, there is a combination of physical, mental, and social functioning. Older people differ from one another. One is biologically younger than the other, and that may differ for each of those domains. While one older patient might be vulnerable in memory, the other might be very lonely or not that mobile anymore. So it's actually hard to talk about the older patients as one group because they are so different. And besides that, older people may have other preferences as to what they still want. The length of life may become less important, while for example independence or social participation become of more interest. But that is very personal. In short, older people are very diverse. Then the scientific evidence. Increasingly, patients are being treated using guidelines based on scientific evidence. The highest degree of evidence is provided by randomized clinical trials, RCTs, or more preferably meta-analysis thereof. In large groups of people, it is observed whether receiving a certain treatment yields better results compared to a large group who did not receive the treatment. It is determined by drawing lots who receives the treatment and who doesn't. This is considered the highest form of evidence. But older people are systematically excluded from those RCTs. We previously found in a study that only 7% of the RCTs target specifically older people, while this group accounts for a much larger proportion of healthcare use. And many studies investigate the effect of treatment on goals that are less important for older patients. We know of many treatments what effect they have on the chance of death, but not on functioning or quality of life. It is thus doubtful whether the treatment of older patients is based on scientific evidence, let alone it matches the situation and wishes of all older patients. The knowledge and expertise of the doctor is very important in evidence-based medicine. But while doctors are working more and more based on guidelines, we have just seen that they may not just apply to the older patient. So what do we do then? Each treatment decision is made on the basis of a balance between the pros and cons. In comparison with young people, the benefits of treatment will usually be smaller in older patients. There are fewer years of life to gain, and in the presence of multiple diseases or even functional limitations, there will also be less complaints reduction. On average, the disadvantages will be greater in older people. Aging results in a greater chance of side effects and complications. It is therefore up to the doctor to make the decision explicit to the older patient. By looking closely at the patient and trying to map the physical, mental, and social functioning of the patient with measuring instruments, but especially by talking to the patient. What does he or she actually consider the most important outcome? How does he or she weigh the pros and cons? That is the basis of shared decision-making. Good. Summing up. Medicine for older people is different than for younger adults because the three elements evidence-based medicine is based on are different. Older people are much more diverse. Physical, mental, and social functioning go hand in hand. And older people may have different treatment requirements that focus much more on functioning and quality of life than on length of life. Scientific evidence is often lacking because relatively few clinical studies focus specifically on older people. And because the evidence is often lacking and guidelines do not simply apply, doctors need to individually weigh down the pros and cons, and that process all along with the patient. Thanks for watching and see you next time.